So good morning, everyone, and I appreciate you taking the time to listen in on this morning's webinar. My name is Christy Strauss, and I'm a broker sales manager at Insurance Advisors Direct. And for those of you who are new with us, I'm just going to give you a quick overview who we are. For those that know us, thanks for holding tight here for a minute. We are a full-service FMO, and we pride ourselves on simplifying our agents' success. And how we're able to do that is by using 7 different pillars that support this success. And the pillars are, and just real quickly, they're product offerings. We have over 45 carriers and 15 different product lines. So that helps us with our agents who do like to cross-sell and enrich their business that way. Although our focus is senior health and life products, we have crossed the line to underage products and many ancillary products. We provide training and education like these ongoing webinars. This webinar will be taped today and housed in our YouTube video library, and in a few days we'll take care and edit all the little rough parts out of it, and it will be available for you to listen to again. We have live sales summits and road shows, and we'll provide training and personal one-on-one webinars for agents that need it. Marketing services available, sales tools. We have turnkey selling systems available for several different product lines, and we also do lead generation programs. Technology, we have provided Medicare Sales Pro, which assists agents in building their own websites, or if they have a website, this can also richen it up and give them quoting tools for Medicare Supplement plans. Coming soon, we'll have one quoting for Med Advantage and even PDP. And lastly, our first-in-class, what we would call first-in-class administrative services. Many of you have spoken with Heather and others in our office, and she is just, bar none, the best around. I'm sure you'd all agree. So with that being said, I am going to go ahead and turn this over to Kevin Cox, and he will begin this HAP Medicare program for 2020. So Kevin, thank you so much, and just go ahead and get started.
Great. Hopefully everybody can hear me okay. Thank you, Christy. I do want to start by thanking IAD for hosting this webinar. So just so everyone can kind of get a picture of the partnership between IAD and HAP is that we have partnered with IAD this year to bring them on as an FMO contract. We're excited to have them on board. They have a very good top-notch shop. They do very well in helping their agents successfully grow and market their Medicare business. So we are excited about this partnership between HAP and IAD. But the intent of this webinar today is to have the agents that attend complete their face-to-face or webinar requirement. So in order to successfully be able to sell and market Medicare Advantage plans for 2020 through HAP, you have to complete 3 steps. The first thing that is required in order to be able to sell and market our plans is that you have to do either the AHIP, the Gorman, or the Pinpoint. We will accept any one of those 3 certificates. The second thing that is required would be a face-to-face training or a webinar. This webinar that we're doing today is going to satisfy that requirement. And then the third piece that is required is that you need to go online through Miramar, which was formerly known as Sentinel Elite, to do our web-based training and take the HAP-specific product test. Once we have all of those things back in-house, you will get an email back that lets you know that you're ready to sell for this upcoming AEP. For those of you that are on the webinar today that are already contracted with HAP, you're already selling our products today, you would have received an email from either myself or Dustin that would give you instructions on how to access the Miramar training. If for some reason you did not receive that, feel free to reach out to me. You can always reach out to Heather at IAD, and we will get you the link to be able to log on there to complete that extra step or that extra part of the training. But really quickly before we jump into this, my name, and I apologize I introduced myself earlier, is Kevin Cox. I am the Medicare consultant here with HAP. So I've been on board with HAP for just about 3.5 months now. I replaced Dustin Van Dyne, so if any of you have worked with him in the past, he is still on board with HAP. He just was promoted to a director role. So I am new on board, but not new to the industry. So I do continue to look forward to working with the agents and helping you successfully sell and market these plans. This webinar will take approximately about an hour. I'll leave it up to Christy in regards to questions. So if we do get questions that come in, I'll be glad to answer them as they come in. But with that being said, we can get started here. Okay, so let's take a look at the agenda here. We're going to talk briefly about why HAP. We'll go over the 2020 Advantage products. We're going to go over the 2020 Medicare Advantage value adds. So when we're saying value adds, we're talking about supplemental benefits, right? The over-the-counter, the dental, the vision, the hearing. We'll talk about the Medicare Supplement plans as well. So the Medigap, we do have a couple changes that are going to be happening in 2020 that you'll want to know about. And then at the end, we're going to go over some additional resources and tools that are available to you to help you be successful when you're working here directly with HAP. So HAP, most of you, if not all of you on the webinar, I'm sure are very familiar with who we are. But just as a quick recap, we are a health plan that is owned by a health system. So we are owned by Henry Ford Health System. We've been the health plan itself has been in business for nearly 60 years. We have over 570,000 members across the state, and we have a leading network of physicians and hospitals. And we'll go over our network here in just a few minutes. A couple other things that you want to keep in mind when you're working with HAP or you're marketing our plans to your clients is that, one, we're nonprofit. So what that would mean to you or what that would mean to your client, right, is we don't have stakeholders. We're not publicly traded. So more of the profit goes back into our plans, goes back into our membership. The second thing is we are integrated. So we are unique in the fact that we're owned by a hospital. So we work closely with the doctors, the hospitals, the clinicians, the care managers to deliver the highest quality of care to our Medicare beneficiaries. And then remember, most importantly, is we're local. So when you sell a HAP plan to a client and they are reaching out to their health plan and they're reaching out to HAP, they are talking to somebody who is residing here, working here in Michigan. So all of our services, so customer service, claims, billing, care management, everything is done here by Michigan employees. So we don't outsource, we don't farm anything out to different states or other countries across the country here. Everything is handled here in Michigan. A couple of things to keep in mind and to keep in the back pocket when you're looking at showing our plans to your clients is that we have a wide variety of plans to choose from. So you can see, or you'll see in a few minutes, that we offer HMO plans, HMO POS plans, and we also offer PPO plans. So we have a wide, broad portfolio for you to choose from. We also have Medicare Supplement plans that your clients will be able to purchase as well, and we'll go over those briefly here in the webinar. And then flexibility. So me being new to HAP, some of the things that I've heard from some agents or from some beneficiaries is that when you show them a HAP product, in their mind sometimes they think, well, don't I only have to go to a Henry Ford doctor or hospital? The answer is no. So we, yes, are owned by a health system, but we have a leading network of doctors and hospitals across our service area, and I'll share what that looks like in just a few minutes. And know that if you do sell an HMO or an HMO POS plan to your client, we do not require referrals on most of the plans. There's a couple that we require, and I'll show you which ones they are. But on most of our HMO and HMO POS plans, referrals are not required to see specialists. And then remember, we do offer out-of-network coverage on all of our plans. So whether you're selling an HMO plan, an HMO POS, or a PPO plan, your client does have flexibility to go out of the network. It will work differently on each one of those different products, and I'll show you how it works, but just know that our clients do, or our members have the ability to go outside of the network. And then more savings. So you're going to see that on all of our plans for Medicare Advantage, with the exception to one, there is no in-network medical deductible. And then on all of our Medicare Advantage plans, you will see that we do not have a prescription drug deductible. So right away, we are giving your client first dollar coverage for both their medical and pharmacy needs. The other thing to keep in mind is, and we'll go in this in great detail when we get to the slides, but we have supplemental benefits built into all of our Advantage products. So built into every single one of our plans at no additional cost, your client is going to get preventative dental, they're going to get vision, they're going to get hearing, they're going to get over-the-counter benefit, and they're also going to get a gym membership. And we'll go over who we partner with to offer those benefits and how they work in just a minute. But just keep in mind, outside of the medical and the prescription drug coverage that's built into the products, they're getting supplemental benefits built in as well. So what are our members saying about their service level and their satisfaction with HAP? So when our members call into the service center, sometimes we will ask them if they want to take a quick survey. And here are some of the feedback that we're receiving. So 97% of our members that are on Medicare say that their HAP plan is easy to use. 94% of the HAP members say that they're satisfied with their plan. And then about 90% say their services are better compared to the previous insurer. So as an independent agent or broker, this should speak volumes to you. This should let you know that when you're placing a client with HAP and they're reaching out to their health plan, that they are getting the level of service that you would expect them to receive, and they're very satisfied with the plan that they're on. So that would mean less administrative stuff behind the scenes for you, and it will allow you to have a higher retention rate with your clients that you place with HAP. So let's take a look at our service area. So keep in mind that HAP is a regional plan. And what that means is that we're only offered here in the state of Michigan. And when you look at this slide right here, you will see that the counties that are highlighted in orange and the counties that are highlighted in that bright blue is where you are able to sell our Medicare Advantage products. So we are not available in every single county across the entire state. These are the counties that we're available in. We are expanding a little bit, and I'll show you we're moving over into the west side, but we are growing, and we're growing at a very fast rate. So when you look at the counties that are highlighted in orange, we call that our core service area. Within that core service area, we have almost all of the hospitals and just over 90% of the primary care and specialty providers within that service area. So you'll see that when you start marketing and selling your plans or showing these plans to your clients, and you're obviously going to be searching their doctors to make sure they're in the network, that 9 out of 10 times you are going to have a hit of the providers being in the network. The other thing that I want to point out in this slide here are two more things. The counties that are highlighted in the bright blue, you can see it's Kent, Oceana, Ottawa, and Muskegon County. These are new counties for HAP for 2020. We are expanding into West Michigan with 2 narrow network products. And I'll go over those 2 plans in the network over there because it is a little bit different on how it's going to work here in just a few minutes. But just know for 2020, we are adding 4 new counties on the west side of the state. The other thing I want to point out on this slide is the last bullet that you see on the screen here, and that says improved visitor traveler benefit on the HMO plans, providing in-network coverage for routine care while your client is traveling to Florida, Arizona, Texas, or anywhere outside of our service area here in Michigan. So let me define this benefit and kind of clarify it for you. So we, on our HMO plans, if you think of a traditional HMO product, they typically don't get out-of-network coverage for anything outside of emergency room visits and urgent care services. And that is how it works on our HMO plans. Our clients have ER and urgent care coverage to any provider that accepts traditional Medicare across the country, as well as international coverage for ER and urgent care, and they're covered at the in-network benefit level. But what we've added to our HMO plans is greater flexibility. So what we mean by that is that if your client is on an HMO plan with us and they're traveling to Florida, Arizona, or Texas, or anywhere in those light blue counties here in Michigan, they can seek routine care and pay the in-network copays. So in order to utilize the benefit, there's 2 things that have to happen. Requirement number 1 is they must see a provider who accepts traditional Medicare. And then you will also see, or they will also need to, Call HAP customer service in advance. Let us know the provider or hospital that they're going to see, and then that way we will reach out to that provider to make sure that they know how to bill us, and then we'll flag the claim so it pays at the in-network benefit level. So it will allow what we kind of term like the snowbirds, right? If they live in Florida 6 months out of the year and they're on an HMO plan with us, and let's say they have a follow-up visit with a cardiologist, or they want to go see a PCP or have physical therapy, they can do so on our HMO plans, and they can pay the in-network copay in those states that we have listed here. They just need to see a provider who accepts traditional Medicare, and they're required to also call us in advance and let us know who they're seeing, so that way we can work with the provider and have a very smooth smooth process when they're seeking these benefits from out-of-network providers. So let's move through here. Let's look at the HMO plans. So this plan right here is what we call our HAP Senior Plus Option 0, okay? This plan is the #1 selling plan year to date for HAP. Of all of the new enrollments that are coming into HAP today, about 70% are going into this plan right here, okay? And then also what you'll want to keep in mind too is that when we get Medicare Advantage enrollments, and whether it's HAP, Priority Health, Blue Cross, Aetna, it doesn't matter, we have to report all of that, and it has to get approved by CMS. So it all gets sent into CMS. And the reason why I bring that to your attention is that CMS reports out enrollment data every single month. So we as carriers can see exactly what consumers are buying, what plans they're buying, what counties they're buying them in. And when you look at all of the enrollment across the entire state of Michigan in Medicare Advantage, and we're talking all the carriers, Blue Care Network, Blue Cross, HAP, Meridian, you name it, just about between 65 and 68% of the beneficiaries are buying $0 premium plans. So if that kind of gives you an idea of what other agents are selling or what consumers are attracted to when they're looking at these type of programs, a large portion are going into $0 premium products. So with that being said, this is our $0 HMO plan. It is extremely rich, and let me just point out a couple things to you. There is no medical deductible. There's no prescription drug deductible. You have a $10 primary care physician copay. You have a $10 PT, OT, ST, mental health copay. $0 lab copay. So when we say $0 lab copay, we're not saying it's capitated, meaning they have to go to Quest Diagnostics to do their labs. No, they can go to any lab that is in our network of providers, and they will have a $0 copay for their lab benefit. The other thing that I want to point out to you on this plan, and this is how it works on all of our plans, is when you see the ER and urgent care copay. So on this plan, it's pretty standard, right? $90 for ER, $60 for urgent care. We handle this benefit at HAP as like a bundled copay or a stacked copay, however you want to define it or look at it. And what we mean by that is that if your client is going to the ER or to the urgent care to determine what's wrong with them, and let's say they start getting labs, they might have to get a CAT scan or an X-ray or an EKG, whatever they have done within those facilities or those services are covered under this one copay. So they would only pay the $90 ER copay or the $60 urgent care copay. Now, if they got admitted into the hospital, those copays are waived and they divert into the inpatient hospital copay. But just know if they're using the ER or the urgent care copay, it is a bundled copay. The other nice thing about this plan is that we are adding a $0 copay for Tier 1 and Tier 2 drugs for a 90-day supply through mail order. So they're paying no premium, they're paying no medical deductible, they're paying no drug deductible. They're paying nothing for their Tier 1 or Tier 2 meds, they're paying nothing for their labs, they're paying very low PCP specialist copay. So you get the hint here, you can see how rich this plan is and you can see why we're having so much success with it. The other things that are built into this plan, and we talked about it briefly, but I'll recap it. It has an over-the-counter benefit. It has preventative dental built in. It has a gym membership, dental, vision, hearing. So it's loaded with supplemental benefits. The other nice thing about this plan is that we do not require members to get referrals to see specialists. And it includes that visitor traveler benefit. So if your client is on this plan, they're traveling outside of our service area here in Michigan, or they're going to Arizona, Florida, or Texas, they will have these in-network copays that you can see for routine care. So moving through to our second option, this is another $0 HMO plan. But what's different with this plan is that it does not include prescription drugs. It is an MA-only product. This plan is very rich in benefits, and I'm sure most of you are aware of who's a good fit for an MA-only type plan. But what I want to point out with you on this plan is that this plan will have the highest Part B premium rebate of any MA plan sold in our state for 2020. We are paying our members $50 a month to take this product, okay? I think the next closest competitor for an MA product is paying $40 a month in 2020. Now let's take a look at the benefits here. There's no medical deductible, there's no PCP copay, $20 specialist copay, no copay for physical therapy, occupational therapy, speech therapy, mental health, no copay for labs, $200 copay for hospital stay. You get the hint here. It's a very, very rich plan. We're offering a $50 Part B premium rebate, and it also includes those supplemental benefits, the over-the-counter, the dental, the vision, the hearing, the gym membership, all built in at no premium. No referrals are required on this product either. And then we also include that visitor traveler benefit. So remember, if your client is traveling to one of those states that we have built into that plan or into that benefit, or anywhere outside of our service area here in Michigan, and they're going to a non-contracted provider with us, they can still pay the in-network cost share or copay for routine care. So let's keep this moving. Let's look at the regional plans. So when we're saying regional, HAP is a regional carrier, okay? So what I mean by when I say HAP is a regional plan is that we are only able to be sold in our service area here in the state of Michigan. We can't sell a Medicare Advantage plan to someone in Florida, Arizona, Texas, or whatever you name it. So when we're referring to the term regional, we're talking about narrow network products. So these next three plans that I'm going to go over are narrow network plans, and I will explain when we get to them here in a second what I mean by narrow network. So let's take a look at the first option. This is what is called the HAP Primary Choice HMO. It is another $0 HMO plan that we are offering. Today, it is available in Wayne, Oakland, and Macomb County. Going into 2020, we are expanding this plan into Jackson, Hillsdale, Washtenaw, and Livingston County. Before we go over the benefits on this plan, I want to just talk about the network here for just a minute. So I told you just a second ago that this was a narrow network plan. What you need to understand is that the primary care physician network on this plan is narrow. If you see in the bottom left-hand side of the screen or the slide here, members that are on this plan must use a PCP in the United Physician Group, Oakland Southfield Group, IHA or Integrated Healthcare Associates, and the Jackson Healthcare Network. So the primary care physician network is narrow on this plan, but the specialist network is the same network as all of our other products, and the hospital network is the same as all of our other plans as well. But what is unique and what is different on this plan is that they must get a referral to see a specialist. So they have to pick a PCP out of one of those primary care physician groups that we have listed there, and they must get a referral to see a specialist. So let's go over the plan and so you can see what, who this might be a good fit for or really some of the strengths with this plan. So it's a $0 HMO. There's no medical deductible. There's no drug deductible. There's no primary care physician copay. There's no lab copay. $30 specialist, and you can see all the other copays that we have listed here. There's a $0 copay for Tier 1 and Tier 2 meds for a 90-day supply. There's a $0 copay for cardiac and pulmonary rehab as well. It includes the embedded dental, the vision, the hearing, the over-the-counter, the gym membership. But in my opinion, the richest benefit on this plan and really what makes it unique compared to any Medicare Advantage plan sold across the state is that we offer Tier 1 and Tier 2 coverage through the donut hole. So if your client is on this plan here and they do the mail order program and they do a 90-day supply for a Tier 1 or Tier 2 medication, they would have no copay all the way into the catastrophic phase. So we at HAP and those of you that use Medicare.gov to quote your client's prescriptions, you probably saw that HAP would come up at the top of the list, and it was probably this plan right here, 9 out of 10 times, meaning this would be, if you put your client in this plan, this would be the lowest out-of-pocket expense for their medications throughout the calendar year. And the reason being is because of the way the plan is built. We also have a very rich formulary. You're going to see here in just a couple minutes that we cover some brand name medications at a tier 2 copay. So I'll give you an example: Novolin, Novolog, Lantus, ProAir. If your client is taking those prescriptions and they were on this plan, they would pay nothing for those insulins or inhaler until they got to the catastrophic phase, and they would pay the defined amount by CMS at that point. You would literally be putting thousands of dollars a year back into their pocket, which is life-changing. So it's a very rich plan, but you must understand that they have to pick a primary care physician outside of the network of those PCP provider groups that we've contracted with, and they are required to get a referral. Okay? Let's move through to the next two options. These next two plans are narrow network products that we're offering in West Michigan. So remember at the beginning of the presentation, I showed you those 4 counties that were highlighted in the bright blue. Those 4 counties will have these next 2 plans available in them. If anybody is currently selling the narrow network plan that's offered by Blue Care Network on the west side of the state, I think it's the My Choice Wellness and another product. This plan is very similar in arrangement as far as the network and how it works. So let me just explain how this plan is going to work. We have contracted with the Affinia Healthcare Network, which is the Mercy Healthcare system, to offer this plan in the west side of the state. It's going to be available in Kent, Muskegon, Oceana, and Ottawa County. Your client must pick a primary care physician out of the Affinia Healthcare Network, and they are required to get a referral to see a specialist. It's a very rich plan. As you can see, there's no medical deductible, there's no drug deductible. $0 PCP, $0 PT, OT, ST mental health, $0 labs, lower inpatient hospital copay, low out-of-pocket maximum, the dental, the vision, the hearing, the gym membership, the over-the-counter benefit. This plan as well includes the Tier 1 and Tier 2 coverage through the donut hole. So if your client is on this plan as well and they're doing the mail order program, they would have no copay for their medication all the way into the catastrophic phase. So it's a very, very rich plan, but you must understand that they have to use a primary care physician provider out of the Affinia Healthcare Network, which is the Mercy Healthcare system, and they are required to get a referral to see a specialist. Let's look at the second option. This is the $26 HMO plan. It is the same exact arrangement as the plan we just discussed that was $0. What is happening here is your client is going to pay a higher premium to get richer coverage. So they're going to have lower copays, lower out-of-pocket maximums. They're going to get a richer over-the-counter benefit. But what you need to understand is that your client must use a primary care physician provider out of the Affinia Healthcare Network, and they're required to get a referral to see a specialist. So let's take a look at the Affinia Healthcare Network and what that looks like. So for those of you on the phone that have sold in West Michigan, I'm sure you're all aware of Spectrum Health and their leading hospital organization over on the west side of the state, and they own Priority Health as well. So there typically are consumers or beneficiaries, however you want to define them, clients that will doctor either in Metro, the Spectrum Health Network, or the Mercy Healthcare system. If you're running into clients that are doctoring within Metro or within Spectrum Health, you're not going to be selling these plans because those two hospital systems are not in the network. But there are beneficiaries that are loyal to the Mercy Healthcare system, and that's what they doctor in, and so these would be the good fit for this product. The Blue Care Network plans that are available over there right now with this almost identical arrangement, they have about 9,000 members in those plans. So there is an opportunity. There are beneficiaries that do doctor within this healthcare system, and they will be attracted to these plans because of the savings on their medical costs and prescription drugs. So it includes 8 hospitals with more than 1,600 providers. I will tell you, if there's anybody that does market and sell on the west side of the state, your biggest bang for your buck probably would be in Muskegon County. I think if you got into Kent County, it's going to be a little bit tougher because you're going to get those that doctor both maybe in Spectrum and in the Mercy Healthcare system. But a lot of those that reside in Muskegon doctor only out of the Mercy Healthcare system. So let's keep going through here, and let's look at the HMO POS plans. So with the HMO POS plan, this is our middle-of-the-road $76 HMO POS plan. When you compare it to our competitors that are in this price range for an HMO POS type product, you will see that it's pretty competitive. Low hospital copay, low PCP copay, lower copay on the PT, OT, ST mental health, lower copay on lower out-of-pocket maximum, competitive prescription drug card built in. It has the dental, the vision, the hearing, the over-the-counter benefit. The most important thing that I want to point out to you on this plan, though, is that remember on the HMO POS plans, on the HMO plans, our members, you can use that visitor traveler benefit to go outside of the network. If they're on the HMO POS plan, they don't get access to that benefit. What they have access to is a POS benefit, a point of service, allowing them to go out of network if they choose to do so. So if your client is on an HMO POS plan with HAP, they have the flexibility to go and see any provider across the country who accepts traditional Medicare. If they're not contracted with HAP, they will fall into the point of service benefit, and then at that point it falls in the out of network, and it would be a different type of cost share arrangement that they would pay. But just know that they have the flexibility to go out of network if they choose to do so. Let's take a look at the PPO plans. This plan right here is not new to HAP. We're currently offering it today, and it's $15 a month. But going into 2020, we are dropping it to a $0 premium PPO plan. It is available in our core service area. So all of those counties that you saw highlighted in orange have access to this product. It's very competitive when you look at the $0 PPO plans that are going to be available in our state next year. One thing you want to keep in mind is that we will be the only $0 PPO plan that's going to have no drug deductible on any tiers. So there's going to be $0 PPO plans that might have a drug deductible on tiers 3, 4, and 5, or on tiers 4 and 5. We don't have a prescription drug deductible on any tier. So let's take a look at some of the benefits on here. There's no medical deductible, $10 PCP, $10 PT, OT, ST mental health, competitive inpatient hospital copay, $0 labs. It also includes an over-the-counter, dental, vision, hearing, gym membership, $0 copay for Tier 1 and Tier 2 drugs for a 90-day supply. The other thing I want to point out to you as well is that because this is a PPO, your client has flexibility to go out of network if they choose to do so. If your client wants to see a provider that does not contract with HAP, as long as they're contracted with traditional Medicare and they accept red, white, and blue card, they would be able to use their coverage. The way it's going to work is it's going to fall into the out-of-network benefit, and you can see it has a $275 out-of-network deductible, and then they pay a co-insurance. So we pay 70% of the cost, they pay 30% up to their out-of-pocket max of $7,000. What you have to understand is the split, 70-30, is we are paying that amount up to the Medicare-approved amount. So that is why we make our members go to a Medicare-approved provider, so that way they can't be balance billed. And we, us as the health plan and the member, are not going to be responsible for anything over the Medicare-approved amount. So just know that that's how that would break down and how it works with the out-of-network coverage. So let's look through now. Here is our middle-of-the-road PPO plan. It's the $55 a month product. I will just be very clear with you. When you compare this plan to our $0 PPO plan, really the only reason why you would want to consider the $55 one is it has a richer out-of-network benefit. It only has a $100 deductible for out-of-network services, and then it goes into a 25% co-insurance. Other than that, when you compare it to this $0 PPO, it's a no-brainer on that $0 PPO option. But just know this plan is competitive. It has dental, vision, hearing, over-the-counter, the gym membership. It has the $0 copay for the mail order on Tier 1 and Tier 2 drugs. You get the no medical deductible, no drug deductible as well. So moving through, let's look at our D-SNP product. For those of you that are on the webinar know that with the dual SNP product, that is for people who have Medicare and full Medicaid. So let's take a look at our plan. This is not new. We have not changed anything for this plan going into 2020. It's going to remain this exact same. With this product, there's a couple things you have to understand. Your client must reside in Genesee County, and they also must be a full dual or a full Medicaid beneficiary. They must have QMB Plus to qualify, okay? So they have to reside in Genesee County, and they have to have full Medicaid. They cannot have a spend down, partial Medicaid. They have to be full Medicaid beneficiary. And those of you that sell in this market or have sold to these type of beneficiaries, you know that typically the leader or really what attracts them to these type of programs is the coverage for benefits that traditional Medicare doesn't cover or that they don't get with Medicaid, right? So let me give you an example, like the over-the-counter benefit, the dental, the vision, the hearing. So let me explain what extras our members get so you can kind of see where this plan might be competitive for you. They includes 20 rides of transportation. It includes a $1,000 benefit for hearing aids, $100 over-the-counter benefit per quarter. It includes preventative dental, and it also includes a comprehensive vision package, so $0 exam and $200 allowance for lenses, contacts, frames, and so forth, and it includes the gym membership, okay? But as you know, with the dual beneficiary, when they're full Medicaid, they don't have any cost share for Medicare and Medicaid approved services. So any doctor's visits, hospital stays, labs, treatments, they don't pay any cost share. Everything is covered at 100%. Typically, the only thing that they're paying out of their pocket for, depending on the level of Medicaid that they have, is very, very small copays for prescription drugs. So let's look at the value adds here. When we're saying value adds, remember we're talking about supplemental benefits. I mentioned to you that all of the plans that we just went over include supplemental benefits built into the premium. The intent of this section here is for you to really understand how the supplemental benefits work and who we've contracted with to provide these benefits. So let's take a look at dental. We use Delta Dental for our dental benefit. Built into all of our plans is one cleaning, one x-ray, and one exam covered at 100% for the year. We will allow our members to buy a rider that we sell that will give them comprehensive dental coverage for like class 3 services, extra cleanings, and so forth. I will show you in a minute how much those riders cost in a second, but just know built into the premium is one cleaning. Also built into the premium of our advanced plans is a vision benefit. We use our own vision providers. So you need to search hap.org to determine the vision providers, and it's a $0 copay for the exam and a $100 allowance per year for lenses, contacts, frames, and so forth. This benefit resets annually, and there's no waiting period. For the hearing benefit, we've partnered with Nations Hearing. What is unique or different with this benefit is that it's a flat dollar copay for the hearing aids. So we don't say we're going to give you $1,000 a year for hearing aids or $500 per year. It is a flat dollar copay. In the way that you're going to determine what the copay is, it's going to be dependent upon the level of technology that your client purchases. So if they want just a standard run-of-the-mill hearing aid, you can see it would be probably around $689 copay per year. We have done the research and we have looked into this, and you can see hearing aids are expensive. Even at these copay levels, they are going to save more money at the copay structure than if we were just to give them a flat dollar amount. It's also a peace of mind for them to know exactly what they're going to pay down to the penny when they go to utilize this benefit. Also included in the benefit is a $0 exam for hearing, 48 batteries, which is typically a 3-year supply. They're also getting a 3-year manufacturer warranty, and then they're getting a one-time replacement for lost, stolen, or damaged hearing aids. Okay? This benefit is built in at no cost as well in all the Advantage products. Over the counter, we use Convey Health. With this benefit, it is a per quarter. So it's a dollar amount that they get per quarter. It will range anywhere between $45 to $100 per quarter. It is a use it or lose it benefit. So let me explain to you is that if let's say your client is on the plan that gives them $100 per quarter, and let's say in March, the end of March is nearing and they still have $25 left to spend, if they don't spend that $25, it does not roll over. In April, they're going to get another $100 for hearing aids. So, or I'm sorry, another $100 for over-the-counter. And then with the over-the-counter benefit is the catalog that your client will receive. They are going to get, the ability to order over the phone, through a form, online, or they can do it online. So let's move through some additional added benefits. So telemedicine. So this is a benefit where your client can see doctors virtually from their tablet, their smartphone, or their computer. It's going to follow the primary care physician copay on the plan, and there is no amount of times that they can utilize this benefit. We went over the traveler benefit in great detail, but just remember that is only for our HMO members, and it allows them to seek routine care when they're traveling to Arizona, Florida, or Texas, or anywhere outside of our service area here in Michigan. Assist America is built into all of our plans as well. With Assist America, this benefit is not travel insurance. It's not covering deductibles, co-pays, and things like that. It is designed to assist a member when they are greater than 100 miles away from their home. Okay, and it's going to assist them with loss of luggage, they lose their passport, transportation of loved ones, translation of medical records. You can see it's an assistance program to help them in an emergency type situation. Silver and Fit is the network we use for the gym membership. It's built into all the plans at no cost. With Silver and Fit, keep in mind it does have some of the larger, more high-end type gyms of Silver, such as Lifetime, LA Fitness, some of the Ys, and so forth. Let's look at the preferred pharmacy pricing on this. Remember, preferred pharmacy pricing is not new. Every carrier is pretty much doing it in the industry, and you understand that it does reduce the cost of the medication if your client goes to one of the carrier's preferred pharmacies. Here's a list of our preferred pharmacies. You can see that we have CVS listed at top. Not that we prefer it over any of the other ones, it's just a very popular pharmacy. But what you need to understand is that because we have CVS as a preferred pharmacy, we're not allowed to have Walgreens as a preferred pharmacy. It's typically one or the other. Walgreens is in our network as a standard pharmacy, just not preferred. Okay. What you can see as well is we have the Rite Aids, the Costco, Sam's Club, Kroger, Meijer, Walmart. Those are all within our preferred pharmacy as well. What I want to draw your attention to is the left-hand side of the screen, though, where you can see those brand name drugs that I mentioned earlier that we cover at a Tier 2. If your client is taking any one of those diabetic medications or those insulins, Novolin, Novolog, or Lantus, we cover it at a Tier 2. If they do the mail order program, they have no copay for those medications in the initial coverage phase. Livongo is listed there. That is not a medication. What that is it is a company that we have contracted with to help manage our chronic diabetic patients. So if they are a heavy utilizer, meaning they're testing frequently, they are going to get access to this benefit. It is a very nice benefit, meaning it gives them unlimited testing supplies, so test strips, lancets, needles, meters. It also gives them a case manager. It gives them this automatic reporting metrics. It's a really nice program that is really going to help assist the member in these chronic conditions when they're a heavy utilizer for diabetic medications. And then the other drug that you see listed there is ProAir. So ProAir is a brand name medication, but we do cover it at a Tier 2 copay. So moving through to the optional dental benefit. So remember how I mentioned that built into all of our Advantage plans, your member is going to get one cleaning covered at no cost to them through Delta Dental. If your client says, well, what about an additional cleaning? Or what about restorative services, so fillings, extractions, dentures, bridge, crowns, root canals? They can get coverage for that, but they have to buy the rider and add it on. We have a buy-up option, so a high and a low. One is $21.39 a month. The other one is $41.26 a month. No difference in coverage as far as what it covers, but where the difference is going to lie is in the dollar amount that your member gets, either $800 a calendar year or $1,500 a year. What is nice about the benefit is it's provided through Delta Dental, which we all know is the largest dental network here in Michigan. There's no waiting periods for the services, and they reset annually, and it does have coverage for Class 3, so implants, bridges, and dentures. If your client does not add this on at the point of sale, so you're sitting down with them and you ask them, do you want to add the buy-up dental package? If they say yes, you're just checking a box and it's going to add the rider on. If they say, you know what, hold off, I don't want to add that right now, and they reach out to you at a later date and say they want to add it, that's fine, but they only have 30 days from the effective date of the Medicare Advantage plan to add the rider. So if they go into effect on, let's just say October 1st of 2019, and they did not add it on, they have the whole month of October to add it. After that, if they have not added it, they must wait until AEP. So moving through to commissions. With the commission structure, we are currently paying the CMS maximum, and we will continue to pay the CMS max going into 2020. So currently we're at 42 for initial, and we're at 241. That's what the schedule is for 2019. Going into 2020, CMS has increased it to allow us to pay up to 510 and 255, and we will pay the max. What I want to draw your attention to is what's written in bold at the bottom there. For 2020, what we are doing is we will reimburse agents $100 for certification if you submit 10 new to HAP Medicare Advantage plans with a 1/1 effective date. The requirement is they must remain active all the way through the Medicare Advantage open enrollment period and still be on the books effective 4/1 of 2020. At that point in April, we're going to pull a report and we're going to see who's remaining on the books. If you still have 10, you will get reimbursed $100 for your AHIP, your Gorman, or Pinpoint. Now, if you're getting reimbursed by an FMO or if you're getting reimbursed by another insurance carrier, we don't care. You will also get reimbursed by us as well if you meet that guideline. So that is it for the Medicare Supplement piece, Medicare Advantage piece. We'll go over the Medigap here. It takes only just a few minutes because there's a couple things that we need to go over, and then we'll go over some additional tools and resources, and then we're going to end the webinar. What I want to mention is that I told you at the beginning what you need to do in order to be able to sell the Advantage plans. In order to sell our Medicare Supplement plans, you don't have to go through all those hoops or tests or certifications, okay? So what would happen with our Medicare Supplement plans is you just need to be appointed with us. That's it. And then you'd be able to sell the plans. No additional training is required. So let's take a look at the Med Supp. So with Medicare Supplement plans, currently we offer A, C, S, G, and N. What we are doing going into 2020 is we're adding Plan D as in David. We're all probably very familiar with what is happening to C and F due to MACRA. We are going to continue to sell C and F in 2020 and beyond to those beneficiaries that qualify for it, okay? But what we're doing is we're adding a Plan D as in David. For those of you that are not familiar with D, D is the exact same plan as G, with the exception that it does not cover Part B excess charges. So Plan G does cover the Part B excess charges, Plan D does not, okay? In order to buy our Medicare Advantage or Medicare Supplement plan, you must be a permanent resident of Michigan, you must have Part A and Part B, and you must continue to pay your Part B premium. If you enroll a client into one of our Medicare Supplement plans and they permanently move outside of our state, they can keep the policy as long as they continue to pay the premium, and there will be no adjustment to their premium. They'll stay at the same premium that they have. Obviously, it's going to be age rated, so as they age or every year they may have an age rate increase, but we're not going to give them a higher rate because they're moving outside of the state. A couple things that you have to keep in mind. For those of you that are on the webinar that are selling our HAP plans today, Medicare Supplement plans today, you know that we only have one rate, one tier, okay? Going into 2020, we're changing that. We're going to have two tiers. We're going to have a preferred tier and a standard tier. And then the rate's going to be based off, obviously, smoker, non-smoker, male, female, attained age, and so forth. What I want to point out to you, too, and the reason we're doing that is going to allow us to bring on a little bit more risk. So right now, our underwriting is pretty tight, to be honest with you, because we really only have one tier. Going into the two-tier structure, we're going to be able to take on some moderate risk or some not as healthy Medicare beneficiaries. What I want to draw your attention to is, do you see where it says Plan C, D, and F will be available? guaranteed issue for loss of creditable coverage. What plan you don't see on there is Plan G. So at HAP, we do not allow guaranteed issue into our plan for loss of creditable coverage. So I'll break it down for you for a second here. Let's say you have a client who is past the age of 65. They've already enrolled into Part B and they're still working and they go to retire. We will not allow them to get guaranteed issue into Plan G. Okay? They can buy plans A, C, D, F, or N. C and F only if they meet the requirements. If they are working past the age of 65 and they only have Medicare Part A and they retire and pick up Part B, then yes, they're allowed to buy G. But just know for loss of creditable coverage, if they're already enrolled into Part B, we will not allow them to guaranteed issue into Plan G. The other thing that we're adding is the household discount. So if you have both a husband and wife that is enrolled into a Medicare Supplement plan with HAP, each of those members will get a $10 per member per month discount. Moving through service area, so a little bit different from Medicare Advantage, our Sup can be sold anywhere in the upper or lower peninsula across the entire state. Rates, these are the rates. I know it says pending approval, it has that watermark on there that needs to be removed. We have been given the green light, or STIFS has approved these rates here. These rates do include all the taxes, but it does not include the household discount. So I want to kind of give you an idea of where our rate stability is so you have a better understanding. Today, for 2019, for a male aging in, our Plan G is $119 a month. Going into 2020, you can see it's going up to $122. For a female, we're at $110 a month. We're going up to $113. So if that kind of gives you an idea of the rate stability, you can see where our premiums are. We got approval, so we are working on getting the marketing pieces, the outline of coverage, the application, everything done so that way we can have it to you so you can start showing and sharing these premiums with your clients. Commissions on Medicare Supplement. I want to point out two things here before we go over the structure. If you're selling an under 65 disabled client a Medicare Supplement plan with us, it is non-commissionable. If you are selling a Medicare Supplement plan to an over 65 beneficiary and it is a new application to HAP, okay? I don't care if they're approved at a Tier 2 or Tier 1, they smoke, non-smoker, guaranteed issue, trial right. It does not matter. We pay the same commission for every single application. The commission that you're going to get paid is going to be dependent upon the letter you're selling. So if you are selling Plan D, G, or N, you will get $250 a year for years 1 through 10. If you are selling plans A, C, or F, you're getting $150 a year for years 1 through 3. So as long as it's new to HAP and they're not under 65 and disabled, this is what your commission structure will be. Let's take a look at some additional resources and tools. This right here, we are required by CMS to put this in the training, but this is just going over the Part D portion as far as the initial phase, the donut hole phase, and the catastrophic phase. Keep in mind there are some changes to the thresholds, the dollar amounts, as well as the percentages that are covered when they're in each one of those phases. So just understand that when you start going out there and marketing and selling the new plans for 2020. Enrollment. So we will allow or accept enrollment for our Medicare Supplement and our Medicare Advantage plans 3 ways. You can do it electronically via this link here. You can do it paper application and mail it to us, or you can email it, fax it as well. So we will accept the paper application or we will accept an electronic application. You will also be able to use Ascend if you want, which is an online enrollment platform, and I'll show you what it looks like in just a minute. But we have licensed or contracted with Ascend to be able to offer this enrollment tool to our Medicare agents. It is not an automatic enrollment, so if you want access to it and you want to start utilizing this tool, you have to reach out to us and we'll get you signed up for it. So let's take a look at the Ascend tool. I'm going to go over this very, very quickly, okay? The reason why is that closer to AEP, we are actually going to do like a live training. We're going to walk through this tool so you can see all of the benefits and how it works and how to use it. All we're going to do here is just show you some of the cool functions that are available on this tool. So with the Ascend tool, you have the ability to do the enrollment directly from there. You have the ability to email or text the scope of appointment to your client and get that done directly through the tool. You have the ability to record your sales presentation, look up at all the applications you've submitted, look at appointments that you've made. You also have the ability to look at their LIS status. So if your client does have LIS, you can put the information in and it will tell you what LIS level they are. It also gives you the ability to verify their Medicare claim number. So we know that Social Security went away from the Social Security number to a Medicare de-identification number. And it's very easy to transpose one of those letters or numbers. If you entered the Medicare claim number in incorrectly, it doesn't let you bypass the screen, okay? However, there are times that you are enrolling somebody that is so new to Medicare that it's not loaded in the system here, that it can't verify it. If that is the case, you need to hit the verify button 3 times and it lets you go past the screen. The other thing is that it's a one-stop shop, meaning you have access to all of our resources and tools back here. So our formulary, our scope of appointment, our summary of benefits, our marketing pieces. So you're sitting with a client and they say, oh, you know what, how does that Silver and Fit benefit work? And then can you give me some more information on it? Yes, you can pull up the flyer right here. You can PDF it. You can email it to them. You can print it however you want to do it. But it's all right here on the tool. Everything is housed back here so you're not searching for it. The last thing is the URL. So what we will do is you get a personalized URL link as well. What this will do is that, let's say you have a client that you sit down and you meet with and you go do your sales presentation and they're heavily considering a HAP product. And they say, you know what, I want to talk to my son or my relative before I make my decision. They call you back a day later and says, you know what, I want to enroll into that $0 HMO plan. Instead of you having to go meet with them again, sit down and take the application, you have the ability to send them this URL link. It is linked to your broker number. So if they submit an application to the link, you automatically get credit for it and you're assigned the agent of record. Ordering supplies. So the ordering of supplies, we let our agents do that on their own. You have the ability to go onto this portal, and with this portal, it's strictly supply ordering. It's not giving you access to any other tools and resources. There's just this. You go to the hapagentportal.com. You'll log in. When you log in, you're going to see there's flyers back there that you can order. So they're pre-approved by CMS, HAP branded marketing flyers, or there are the sales kits back there. So the MedSup kits, the Medicare Advantage kits, and so forth. When you go in there and you log in, you'll have the ability to order those. You'll put in your address and we'll ship them to wherever you have that listed. We want to make sure that if you are going to be selling and marketing HAP plans for 2020 AEP or for this upcoming AEP, that you have the kits by October 1st. So we are going to ask that if you want your kits by October 1st, that you go on and order anytime between September 6th through the 15th, okay? If you order between those 2 dates, we are going to guarantee that we'll get you those kits by 10/1. If you're ordering after 10/15, you may still get it by 10/1, but we're not going to guarantee it. We will send out a reminder email when right around the 6th of September to let you know that the 2020 kits are going live on here and to please go on and place your order. For general questions or contact information, if you're working with IAD, Heather and the other end of folks there are great resources for you to utilize. However, you can feel that you can reach out to me directly as well. You can call me, you can email me, you can text me. My contact information is there. I'd be glad to assist you in any way that I can. I will be very upfront when it comes to commission or appointment type questions. Stacia Collins that you see listed here is your resource. Not that I don't want to get involved in that, it's that I don't have access to those systems. I can't review your commission statements. I can't see your book of business. So if you want questions or inquiries on that, go through Stacia. If you're not getting anywhere, you're getting information that you don't feel is up to par or 100% accurate, feel free to reach out to me. I'll work internally to make sure we get the answers or get you what you need. But just know that I have very limited access to those type of inquiries. So we are at the end of our webinar here. We're just after 11 o'clock. So despite starting a few minutes late, we are ending on time. I want to just mention a couple more things before we end the webinar. Remember, in order to sell our Medicare Advantage plans, you must do 3 things. The first thing is you have to complete the AHIP, the Gorman, or Pinpoint. We will accept any one of those 3 certificates. The second thing is you have to do a face-to-face training or a webinar. Christy, I apologize, is going to send me a list of those of you that were on the webinar, so that way you are going to get credit for this portion of the training or certification process by attending this webinar. So right away, you've already got one thing knocked out. The third thing that you are required to do is you are required to go on to Miramar Agent. You can see the link right here. This is the former Sentinel Elite. So I've had a lot of agents reach out to me and say, I don't know my password. It says I've already registered for this. This is Sentinel Elite. So whatever you use to log in to Sentinel Elite, this is the login credentialing that you're going to use for Miramar Agent. They just changed the name. Once you get back into the Miramar Agent login, you will click the Register New tab, and you're going to enter the PIN that is provided to you by either myself or IED to take the HAP course. When you go in there, you're going to do the module, and you're going to take the product test, which I believe is 20 or 25 questions. Once we have all three of those things done, you are going to get an email that says you are ready to sell for 2020. You all, if you're appointed with us today, should have received the link in the training information to do Miramar. If for some reason you did not receive it, reach out to Heather, or you can reach out to myself, and we will get you that information so you can complete that step. The last thing that I want to remind you is that we will reimburse you $100 for the certification if you write 10 new to HAP Medicare Advantage plans with a 1/1 effective date that remain active all the way through the Medicare Advantage enrollment period, and so they must be effective on 4/1. With that being said, we are at the end of the certification or the training portion. If anybody has questions that you can't think of, or you didn't think of now, and you come up after or later, feel free to reach out to myself, call me, email me, or text me. I'll work with you to get those answered. I do thank you all for taking your time to jump on the webinar to learn more about HAP and to complete this portion of the training. Good luck this AEP, and I look forward to working with all of you, and hopefully everybody has a good, long holiday weekend. And this is the calm before the storm, because things are about to get heated up here shortly, as October 1st is right around the corner. But thank you all for attending, and with that being said, we will end the webinar.
Thank you, Kevin. Thank you very much, everyone, for learning more about this great product. We're super excited about partnering with HAP this year, and as you can see, it's hitting a home run, so we're thrilled. So again, feel free to call me or reach out to Heather with contracting questions, but just know I will be following up with each of you just to ask for more information or for your appointment information as well. Kevin, thanks again, and you all have a great Labor Day weekend.